Dear colleagues, I'm Mariman, psychiatrist and ESRS certified somnologist working at the Ghent University Hospital in Belgium, teaching and researching on sleep and chronic fatigue. Our research group has developed a keen interest in the effects of insomnia and sleep disturbance in a range of specific situations, including chronic fatigue syndrome, but also in sports and in postpartum women. The study has been recently published in BMC Pregnancy and Childbirth and consists of a prospective observational study of sleep and fatigue according to baby feeding method. The originality consists of a longitudinal design involving different time points from late pregnancy over early and later postpartum. Indeed, sleep is vulnerable to disturbance in postpartum. Contributing factors not only include the peripartum with pain following caesarean section and immediate postpartum blood loss, but also disturbances in sleep architecture with decreased total sleep time, lesser sleep efficiency, and increased wake after sleep onset. The postpartum period is associated with less support by family and friends and an increase of depressive symptoms. Finally, breastfeeding is perceived to contribute to sleep disturbance. In general, disturbed and low sleep quality are associated with fatigue in mothers, leading to an increased risk of developing depressive symptoms with a potential of outright postpartum depression. However, it is well acknowledged and validated by the WHO to encourage the uptake and maintenance of breastfeeding because of documented significant reductions in child morbidity and mortality, the latter in particular in low-income countries. Uptake and maintenance of breastfeeding is compromised by a prevailing opinion or perception against breastfeeding, namely that breastfeeding is responsible for less time in bed and hence reduction in total sleep time as well as more sleep fragmentation, in turn leading to more fatigue, depressive feelings, and breastfeeding cessation. But it needs to be questioned whether this assumption holds true, in particular as a very limited number of earlier cross-sectional studies, including one from our own research group, demonstrated similar postpartum fatigue and subjective sleep quality assessed through the PSQI in breast and bottle-feeding mothers. Actually, within the different PSQI dimensions, in breastfeeding decreased total sleep time was compensated by increased sleep quality as compared to bottle feeding. In order to further elucidate the issue of the impact of feeding method on sleep and depressive symptoms, we conducted a prospective longitudinal study using different validated questionnaires probing for sleep quality, insomnia, fatigue, and depressive symptoms at different time points, first upon recruitment at 35 to 37 weeks of gestation, in early postpartum at 2 and 8 weeks, and later postpartum at 6 months. Expecting mothers were recruited in the obstetric departments of 2 Flemish hospitals, one university and another large non-university. Appropriate statistical methods and sample size calculations were performed in order to compare by definition asymmetrical groups changing in composition between sequential time points, as the choice of initial feeding method is by definition not randomized and mothers switch from breastfeeding to bottle feeding in early and late postpartum. This involves the statistical concept of the harmonic mean, the minimal number of patients to be included to allow comparability. This slide demonstrates the dynamics of feeding choice and the group composition through the different time points. First, upon recruitment, 188 pregnant women were included in the study. The majority chose for exclusive breastfeeding at 2 weeks early postpartum. At 8 weeks, there remained sufficient mothers in the breastfeeding group, but this was no longer the case at 6 months postpartum, not meeting the pre-requirement of the harmonic mean. Thus, at least for the 2 early postpartum time points, a sufficient number of mothers were included for both feeding methods to allow statistical analysis. Overall, there was low fallout over the study period. This busy slide summarizes the wealth of data on the different dimensions of sleep, fatigue, and depressive symptoms upon recruitment in late pregnancy, or T0 at 2 weeks, 8 weeks, and 6 months postpartum. Significant differences are highlighted. Experienced fatigue is higher in the prenatal period in mothers choosing for bottle feeding as compared to those who went for breastfeeding. Fatigue did not increase with the uptake of breastfeeding. Fatigue decreased to similar levels as in breastfeeding in early postpartum in bottle-feeding mothers. Fatigue levels did not further change at 8 weeks postpartum, and in global no differences nor significant changes were observed for global sleep quality, insomnia, and depressive symptoms. In a regression analysis, prenatal level of fatigue was the only variable that significantly contributed, as to say predicted, the initial choice for bottle feeding. In a similar way, depressive symptoms at 2 weeks postpartum were associated with early switch to bottle feeding. In summary, 188 women indicating a choice for either bottle or breastfeeding in the prepartum were included with good retention throughout the study period. Greater fatigue in late pregnancy was moderately associated with choice of primary bottle feeding. Fatigue decreased at early and late postpartum in bottle feeding, but remained unchanged in breastfeeding, resulting in similar fatigue with both feeding methods. Moreover, there were no differences in sleep quality or insomnia symptoms at all time points. And finally, depressive symptoms in postpartum were associated with early discontinuation of breastfeeding. In conclusion, fatigue and depressive symptoms have a negative impact on breastfeeding initiation or maintenance and influence feeding method dynamics. Breastfeeding is not associated with increased postpartum fatigue or increased insomnia, as demonstrated in earlier cross-sectional studies, indeed showing that different components of the PSQI are affected differently by either breast or bottle feeding, with better sleep quality in breastfeeding in spite of sleep disruption. This supports the need for active screening for depressive symptoms and fatigue in late pregnancy and early postpartum in order to improve the goals of breastfeeding initiation and avoid early withdrawal. Thank you for your attention.